The most rewarding part of my job is getting to meet people and hear their stories, and particularly at a point in their life where they may be struggling to support themselves. Working here, you're reminded of human strength and resilience, and it's just really rewarding to be part of that journey with people.
There are a wide variety of career paths in mental health care. Mental health care is delivered by multidisciplinary teams, or MDTs, which include psychiatrists, who are medical doctors specialising in the prevention, diagnosis and treatment of mental, addictive and emotional disorders. Psychologists, who are clinicians and researchers helping people to develop insight and understanding into their thoughts, feelings and behaviour. They deliver specific, evidence-based models of therapy. Pharmacists, who provide the MDT and people receiving care with information about safe and effective use of medicines. Psychiatric nurses, who are specially trained to care for psychological and physical well-being. Social workers, who provide help to people and their families through information, advice, counselling and advocacy. Occupational therapists, who work with people to enable them to participate in and make the most of the everyday life activities important to them. All of these different professionals work together in a team to make sure that all of our mental health needs are met.
I decided to go into a career in mental health because I think it's an area where you work really closely with people, and I love getting to know more about people and what makes people work, what makes us function well in society, what difficulties people have, and how we can try and address those problems to get people back into things that are meaningful to them.
I suppose I was inspired by the other pharmacists that I saw working in mental health, and I really feel like they made a difference to the care of the patients that they looked after. Also, from a pharmacy skills perspective, we get to put an awful lot of our training into practice. So that means we advance ourselves while also looking after the patients as well. So it's a really great job.
Essentially, I'm over all our student nurses that currently come and work with us over a 4-year undergraduate programme. So if you're looking to come into mental health nursing, generally that would be an application through any of the main colleges. Trinity College is associated with St Patrick's Hospital. We do have relationships with the Royal College of Surgeons as well. When we've one of the oldest schools in St Patrick's for mental health nursing schools, so we have a good prestige there.
The most rewarding part of my job is how closely I get to work with individuals, and then helping them kind of identify what's important for them to change and really working with them on those particular priorities that they have, so the person's really in charge of their treatment and what they'd like to focus on.
I think the extent of patient contact that we have, so within mental health probably more so compared to other settings for clinical pharmacists, we have a lot of patient contact, which is not always the case within pharmacy in Ireland, so it gives us a really unique perspective, and it also means that mental health is a really rewarding job for pharmacists.
Dealing with service users and making sure getting good outcomes for them with the treatment you provide as a clinician. So that's the most rewarding part, that they get well and stable after receiving treatment here in our service.
I work with children and young people, and I think the privilege of hearing their stories and working with young people and their families on their recovery journey.
So one of the most rewarding parts of my job, I think, is to allow people a space to understand that actually the things that have happened to them in their lives have a big impact on how they struggle now. So actually a lot of their difficulties aren't their fault, and that tends to help people feel a lot more empowered to do something to change what's happening for them.
For the most part, it was the St Patrick's University Hospital Walk in My Shoes programme. Originally, I was stuck between law and psychology, couldn't figure out which one it is, but after doing the programme here, I realised that there's something very rewarding about helping other people. If you're the type of person who likes to see people succeed and enjoys playing a part in that, I'd definitely recommend studying psychology. It also kind of makes you see everything a little differently, but in a very good way.
If you'd like to find out more about mental health and career paths in this area, visit the Walk in My Shoes website, walkinmyshoes.ie.